All right, well, I'll pick this question. I'll put it to both of our MPPs. And I actually forgot who gave me this question, so it is kind of neutral. Other than I like the question. What can the provincial government do to change the power structure of hospitals to take power away from the board and the CEO and give doctors and nurses and staff more input? Now, I believe your mic yeah, it's live.
Well, I'm not the health minister, so I can't create policy. However, I think the movement of better supports in the community system, and speaking to Paul Woods at LHSC, he's in agreement that more support and direction should be put into the community sector. If you can pull the need of making sure the hospitals are what we focus on when we get sick, if we can pull that need back into the community to have the support, so the doctors or nurse practitioner-led clinics, or the expansion of the scope of practice for many healthcare professionals we're moving on, or the CHCs that are out there, giving them more support in the community, giving them more access to patients, that will pull the need and the reliance on our hospital system and truly only have the hospital, I guess the end goal, to only use it for really acute sicknesses, or definitely the surgeries that you need to have, and heading down that path. I think the good step is, as I said earlier, we're on the same path forward with the OMA right now at this point. I think that's key into driving innovation. You're not really going to be able to change anything of the health care system until you're actually rowing in the same direction with healthcare providers. So I don't think it can change overnight. I don't think it can change in 5 years. I think it's a long-term goal, is to build up the community structures, the various ones that are out there. Maybe there's new ones. Hopefully these new healthcare teams that are being created throughout the province will take a lot of that away from the hospitals, because there'll be more smaller teams focused on a certain segment of the population to make sure they're getting the home care. Lots of examples from West Elgin where you could really grow on that.
Thank you. Thanks for that. Peggy, I'll obviously give you a chance as well.
Okay, I think there is a real concern, though, with these Ontario health teams, that they could be dominated by the hospitals. And I think what we heard tonight is that we need investments not just in doctors and nurses, but also in the child and youth workers, the mental health workers in schools. We need housing support workers for people who are moving from homelessness into housing. We need PSWs to provide those kinds of wraparound supports that people need to remain independent in their home. What this government has decided to do in terms of investing in these kinds of professionals, they've cut funding actually from the healthcare budget. There was a slight increase in funding, but it falls below the rate of inflation, so that means it's effectively a cut. But it's also far lower than the amount that the Financial Accountability Officer, who's the independent watchdog of the legislature, it's far lower than the amount of funding he said would be needed to deal with population growth and population aging. So we need to ensure that there is funding available to provide the sort of upstream supports that are going to prevent the demand on the acute care system in the hospitals, which is definitely the most expensive place to provide health care.